Very good afternoon to you, Uncle. So today with us we have Dr. Jayantha Liyanarachchi, a medical personality who has experience in pediatric anesthesia, ICU, accident and emergency and neurosurgery, currently working in overseas. First of all, I would like to show you my immense gratitude for being with us here today. So actually we are going to talk, or we are going to have a small discussion about a very infectious disease, polio, that took over the world back in the day and now has been eradicated worldwide successfully. So without any delay, I would like to move along with the questions. So, Uncle, what is actually polio according to medical terms?
Good afternoon, Samla. Polio is an infectious disease which affects human central nervous system. So this is viral disease transmitted by fecal-oral route. So basically, this is viral infectious disease affecting human central nervous system, resulting in paralysis.
Okay. So then, when it comes to when a person is affected with polio, what is the pathophysiology of it?
So I have to say it simply. So you know that in our body, for our functions and the motor functions that they're responsible, there's motor neuron responsible for the motor functions. To work, you have to grip objects, walking, running, climbing, and writing. Each and every functions, there's a motor neuron responsible. So the polio virus basically destruct these motor neurons. So as I told, this is fecal-oral disease. Usually that feces contaminated with water, those are consumed by oral route. That means poor hygienic people, those who are consumed this contaminated food or water, then this virus is in the gastrointestinal tract. From that gut, that virus goes to the bloodstream. So from bloodstream, it goes to the lymphatics, limbs.
Yes.
So from the lymphatics, it goes to the spinal cord or brain stem. So you basically, this will bind to the receptor, bind as receptors on motor neurons. So motor neurons, once you get binded, this will destruct the motor neurons. So motor neuron destruction means there's no function from the motor neurons. So there are different muscle groups in our body. So this will affect, and these muscle groups are affected. So motor neuron itself affecting groups of muscles. So maybe in hands, maybe in lower limbs, or maybe in the respiratory muscles and diaphragm. Likewise, it will affect our muscles. So once it gets affected, we should know that limbs are affected more. I mean lower limbs. Okay, but the fatal thing is, once it get affected, the diaphragm and respiratory muscles results in respiratory paralysis. It is life-threatening. Okay, people cannot breathe in that cases. So this is what happens in the poliomyelitis. But in the polio, we have to say one thing. Out of 100 people get infected, only 1% shows paralysis. Remaining 99% have no paralysis, but 70% have not shown any symptoms. They are totally asymptomatic. So this is bird. We cannot see 70% of the people, those who are having any clinical symptom. So other 29% shows only flu-like symptoms. You know that headache, fever, body aches, maybe diarrhea, like that. So only 1% shows the paralysis.
Okay. Thank you, Uncle, for that question. So we all know that polio took over the world a long time ago, though it was eradicated with time. So what is the history of polio and how did it affect the world and Sri Lanka?
Okay, so basic literature in the US, it says in 1894, one outbreak occurred in United States, having 18 deaths and 132 paralyzed case. So that is in almost 130 years ago. Okay.
Okay.
So at the same time, after 1916, again polio outbreak occurred in New York. Okay, that one little bit severe outbreak, having 2,000 deaths in New York City itself and 6,000 deaths in United States. You know that by looking at previous figures, no? So that deaths 6,000 mean how many infected people?
Around 10,000.
Yeah, no,
10,000.
that means 20 folds maybe.
Uh-uh.
Okay, so that is the severity.
Uh-uh.
So 1916, but by that time even they don't know about the polio virus. There are some clues. Some scientists, they have predicted about the virus in the ago, that 1995, the Ivor Wickman, who's Swedish scientist, he told that this is an infectious disease. That is the first thing in the
Uh-huh.
medical history
Uh-huh.
regarding polio. It's an infectious disease. And also he explained that some victims are asymptomatic.
Uh-huh.
So that's the first literature about the polio regarding scientists. And 1998, 1908, the Karl Landsteiner, who's an scientist in the Austria, he told that these infectious agents are very small, even smaller than bacteria. But by that time, no electron microscope invented, so they cannot identify or isolate these viruses. Okay, that occurred after 4 decades in 1950s. Until 1950s, nobody has seen the virus in the microscope. Okay, so what happens in at the same time, you know that this polio causes paralysis. I told you that it get paralyzed. Diaphragm and respiratory muscles also get paralyzed. Then what happens? You cannot breathe. Then for that, first artificial ventilatory machine that is called iron lung was invented in 1929, almost 94 years ago. No, so is the only thing that time. And 1950s, they in the US also they recognize some respiratory paralysis causes. So that this is pathophysiology and some medical history regarding in the world. But in the once we think about the Sri Lanka, we'll see about the Sri Lankan condition. And do you going to ask it later or now? May I explain it?
It's better if you can explain it now. We can go with the flow.
Yeah. So, okay, in Sri Lanka, inwritingly in 1962, they have detected cases. Okay, so cases mean 180 deaths and 1,810 cases. So that means out of that detected cases, 10% death rates. Okay, with the time it will improve. The endemic state getting reduced. So in 1968, only 1,009 cases reported. So imagine that previously, almost 6 years back, only 1,810 cases. But after 6 years, it became 1,009 cases.
Okay.
In 1974, it was 608 cases. Okay. In 1980, 264 cases. You can see the gradual decrease of that cases. And 1986, 9 cases. And in 1993, the reported last case was seen in Monaragal area. So that is the Sri Lanka, that history regarding the Sri Lanka. And in 1962, so 1963 onwards, we started vaccination of this polio vaccination introduced to our immunization program. But with the, health development of health infrastructures, you can see the gradual decrease of cases. So
Uncle,
that is the Sri Lanka.
So, Uncle, throughout the Sri Lankan cases, as Uncle said, there is a very large decreasing. there's a high rate of decreasement throughout the years from 1968 to 1974. There's a huge drop down from the number of cases. So what has, like, if it's a government or if there's any other body linked, what have they done to bring Sri Lanka up to this state to be free from polio?
Yeah, usually you know that in Sri Lanka we have good immunization program for the from newborn child to the adult. Even during, you can remember during that COVID outbreak, they tried maximum coverage of our population with the immunization. So extended program of immunization, that's called in Sri Lanka. So 1963 onwards it started. Okay. So initially I told you oral polio vaccine. That is that we should know about the immunity developing regarding this polio, basically from breast milk of the mother. Initially, within first half an hour, child should be fed by mother. Then that special breast milk called colostrum is available in that breast milk, which is very rich in immunoglobulin, which fighting with the microorganisms. So with this colostrum, newborn child has immunity, but with the time that immunity level of immunity decreases. So what happens, we should boost that immunity by vaccinating the child. This vaccination itself, not just giving an injection. This polio vaccine is oral. We are putting oral drops, so that is called OPV. So usually it is with the time duration. Initially started in 2nd month of age. 2nd, 4th, 6th, 18 months, and then 5 years. Okay. So this regular vaccination will develop immunity. So once we applied for the whole population and whole newborns in the Sri Lanka, it's very vast program. And this is the reason behind that. Not only that, there are a lot of preventive measures are there to identify cases and improve the hygiene of the population and case detection and case follow-up. We have to follow up the cases. We should know from whom we get infected, and we have to prevent their spreading this virus to the community. Okay.
Thank you for
this
the
is
question.
the Lanka, and their special program for the polio is established in Health Ministry.
So we see that many treatments are given for the patients who are infected with polio at present. So what are the types of treatments and care given to a patient who is infected with polio? Though it's not a viral disease right now, there must be some definite, or there must be some kind of treatment given to a patient if the patient is infected. So what are those types?
Of course, you know that I told you some people are having only just flu-like symptoms. Headache, fever, body pain, joints pain, loose stool, like that. But as per virus concern, there's no definitive treatment. You know, even dengue, there's no definitive treatment. For the polio, even for the corona, there's no definitive treatment. Okay? Only we have to support the people. Okay? Supporting people mean encouraging their, bed rest, and given sufficient fluid, adequate fluid, and adequate nutrition, and in case of severe cases, maybe ventilation. Okay? So these are the way we are treating them. So we have to encourage and make their comfortable, and we have to make sure there is speedy recovery, and we should know we have to prevent complications. Adverse effects. So what are the complications in polio is there's thing called post-polio syndrome. Post-polio means now, during first episode, you will get infected. You would get infected, only simple flu-like symptoms. But even after few decades, 15 years to 40 years, up to 4 decades, there is a possibility of developing paralysis. That is the fact. That is the thing we have to mention. So we have to prevent that complications. So That is the danger of polio, that latent polio will develop later as a paralysis. So we have to support them, and supportive care. At last, supportive care is ventilation. Once your respiratory muscles get paralysis, you have to ventilate the person.
So thank you for that question, Uncle. So from that, what I understood was that the basic care we give is the supportive care, because there's no definite care given for viruses. So you just give care and support for vomiting medications, then pain medication, pain releasement. So
Yeah,
yes. So personally, I believe that with all these treatment and care, they have successfully eradicated polio from the world, from the South Asian region, Sri Lanka, and all over the world. They have eradicated. And according to what Uncle said regarding the post-polio syndrome as well, and also Uncle said about the vaccinations, outbreak control as well. So, if there are any bodies linked, like if I consider the WHO, the World Health Organization is concerned, because I saw that they have a program separate related for polio. So, what are these different bodies in relation with this disease planning to do in order to prevent this disease occurring in the future again? Like, there can be a possibility.
anyway, usually in the world, I know there are a lot of challenges, but the main body is World Health Organization, and there are World Children Funds and a lot of bodies voluntarily involved in this thing. And basically, WHO, they are doing researches to make new vaccines cheaper in price and good in quality, and they are freely distributed among worlds and basically in third world countries, and they try to eradicate it from the whole world. I know that already there's a big achievement is there. Only limited cases were reported in 2020 in Afghanistan and Pakistan. Other than that, it is near totally eradicated in the world. But you know that virus, they are evolution, and there are a lot of changes, mutations occurs. Then new strains of virus will be appear later. That is also a challenge. So we have to do new researches regarding this mutations of the viruses, and we have to develop new vaccines in the future. So for that purpose, a lot of researchers done in private institute as well as in WHO to focus in the eradication.
So, in a nutshell, what I understood was that they are currently doing different investigations, different eradication programs. They are doing different tests to identify new strains of this virus as well. So, finally, I would like to ask this question. So, what are the future challenges of polio, either in eradication, either in investigation, either in the distribution of the virus? And Uncle, personally, what's your message to the world regarding this polio? How can we prevent this?
Challenges, I told you. One is from virus side. I told you, virus can get mutated. Okay, so new strain, new serotypes will be developed, and we don't know. That's maybe the one challenge. Number two is the overcrowding of population in the world, as well as unplanned urbanization. That's a main thing. Even you know that in the Candy City, there's a historical city and a commercial city, but these are mixed up. In between, some unplanned buildings are there, and their water drainage are not properly organized. This is called unplanned organization. All over the world, in some countries, in India, Sri Lanka, and our South Asian region, that is very common, and African region, unplanned urbanization is very common. So that this unplanned urbanization is one challenge in the world. Okay, so very difficult to establish a good hygienic level in unplanned urbanization. So that is one challenge. So we have to overcome this unplanned urbanization. Number two is global warming. So what happened? You know that the world temperature goes up, and this kind of virus get activated. Okay. Number three is internally and externally displaced people in the world. like nowadays in Gaza strips, lot of people's displaced in the area and war affected areas. And so what happens? They stay in refugee camps, and these camps are not well maintained and very overcrowded. So these are the very vulnerable places, and lot of children are there. Basically, in refugee camps, lot of children, pregnant ladies, those are the very risk group. Okay, so these are challenges. So internally and externally displaced people also. So we told about the global challenges, no? And whatever the virus, the viral disease, we cannot eradicate it isolatedly. We have to be hand in hand with the world, other countries, other nations, other population, other ethnic groups, irrespective of their background. Okay, so globally these are the challenges. So overcrowding, it's a very, very big challenge. Global warming is nowadays discussing in big levels. I mean, BRICS, some countries making their own forums, and they discussing and they try to get the solutions. So environmental pollution, unplanned urbanization, those are the challenges. So whatever the disease outbreak, these are the challenges we have to do very, very sensibly, and we have to develop the surveillance system. I mean, disease identification, preventing of outbreak, and disease follow-up system. At the same time, we have to develop manpower and infrastructures of the medical treatment centers, I mean hospitals and medical centers. At the same time, we have to do vast programs, like we have to appreciate your attempts to give a message to the community in your level. Okay, so we have to do awareness programs. Okay. So that these are the challenges, and we have to do in this way.
So
we have to follow these things.
So from all these questions, what I understood was that it is as of right now, because since polio is not that much going viral these days, it is important for us to be aware and just to have some kind of a medical literacy about how polio started and how it might affect in the future as well. So I personally believe this might be very informative about polio, and this might spread awareness as well. So again, I would like to thank you very much, Anka, for being with us today for this small awareness program. And thank you very much for everything, for giving us information and making us aware. Thank you very much.
Yeah, anyway, your motivation and your attitudes regarding this one is highly appreciated. Thank you, and it's a great effort, and have a bright future for you.